You're also going to start having contractions, and you may have a rupture of membranes. Not everybody's water breaks in early labor, but it happens to about 10% of people. But if you do think your water's broken, you need to come immediately to the hospital. Early labor, where will you be? Well, you need to discuss this with your doctor. They may tell you you can stay home for a little while, or they may tell you you need to come straight on to the hospital. The important thing to remember during early labor is save your energy and try to rest. Usually women are very excited at this point. The end is near. They're about to be a mother, and there's a lot of excitement and anticipation, and they want to call everybody and talk to everybody and let them know what's going on. But this is the easy part of labor, and you need to try to rest and save your energy for the hard part of labor, which comes when you push. Spontaneous rupture of membranes. This means your water has broken. Water breaks before the onset of labor in less than 10% of moms. Always report known or suspected rupture of membranes. You should be delivered within 24 hours. That amniotic sac provides a barrier against bacteria to protect you and the baby. Once that water has broken or there's a tear in that amniotic sac, you are open to bacteria. So we want to know if you think your water's broken. If you think your water's broken, make sure you come to the hospital. It's better for us to tell you that it's not broken and send you home than for you to sit home and develop an infection. When your water breaks, it can be a big gush of fluid, or it can be just a slow, continuous trickle, depending on where the water breaks. I'll also mention that when your water breaks, it's a continuous thing. It's not a one-time thing. From that point until you deliver, you will have amniotic fluid come out. Sometimes it'll just leak. Sometimes there'll be a big gush of fluid as the baby moves and opens up more pockets of the fluid. Well, what if your water doesn't break? Sometimes the doctor will break it for you. This can speed up labor, and a lot of times the doctors like to do that. They use a small plastic device called an amni hook. It looks a little bit like a crochet hook. It doesn't hurt. There are no nerve endings in the amniotic sac. So once the fetal head is engaged in the pelvis, the doctor may decide to break your water. It'll help get things speeded up a little bit. Active labor is, during active labor, your contractions and your bloody show increase. Your contractions may get more intense and more frequent, more painful. You may feel a lot of pressure. And the bloody show increases because the cervix is dilating, and all that stretching can cause it to bleed a little bit. Transition of labor is from 8 to 10 centimeters. It's the shortest phase, but it is the most intense phase. If you have an epidural, you may notice things like shivering or vomiting or even the hiccups. A lot of times family members will say, oh, she's cold, but it's not cold, it's that rush of hormones. If you don't have an epidural, you may experience just some real intense emotions. You may feel like you can't do it, that you're not going to be able to manage, but you will, and your partner needs to be there encouraging you, and your nurse will be there with you too, telling you, yes, you can do it, it's almost over, and the end is near. Physical signs of transition: increased pain, nausea and vomiting, hiccups or burps, heavier show, temperature swings. You may get cold feet at this point, so make sure you bring your socks. Cramps, trembling, the urge to void, or the urge to push. That urge to push can also be felt as rectal pressure because the baby's head is putting so much pressure on your perineal area. Just make sure you don't push until the nurse says it's okay. If you start pushing before you're 10 centimeters, you can cause your cervix to swell. Psychological signs of transition: you may be restless and irritable and a little bit irrational, discouraged, panicky, drowsy, disoriented, very sensitive to things that are said around you. You may not want to talk to anybody. You may not want to respond to anybody. And at this point, you may have a little bit of loss of ambition inhibitions. If you're very modest, usually at this point, you may not care quite as much. Stage 2 is when we let you push. We let you push when you're 10 centimeters, and stage 2 ends with the delivery of the baby. Now this can take up to 1 to 3 hours for a first delivery. You may be lucky and be one of those people that only has to push a little bit, or you may have to push a long time. How well you push often determines how long you have to push. Make sure you listen to your nurse and follow what she says, because she's going to try to help you to push the most effective way to get that baby out. Stage 3 is from the time the baby is delivered to the delivery of the placenta. This can take a minute, it can take a little bit longer. At this point, the doctor is still with you, and they're going to watch for that to come out, and we'll start an infusion of Pitocin after the delivery to help make sure you don't bleed too much. For the baby, we're doing APGAR scores, at 1 minute and at 5 minutes after delivery. We look at the baby's breathing, the baby's heart rate, the baby's color, the baby's tone, and normal reflexes. A perfect score is 10. Very rarely, though, does a baby get a 10 APGAR, because that means it has to be absolutely pink from head to toe. With a lot of babies, they experience what's called acrocyanosis, and that's where their little hands and feet are blue or purple. And that'll cause us to count off 1 point for color. It's okay, it's normal. It can be a little distressing looking sometimes for your child to have purple hands or feet, but it will go away. During this time, we also take identification measures. We have bracelets. Mom gets a bracelet, Dad gets a bracelet, baby gets a bracelet. We put the one on the baby on their ankle. These all match. They have the baby's name, the baby's medical number, the date of birth, and it has an ID number on it that is exclusive just to that set of bands. And that's how we'll make sure that that is your baby. We'll also footprint the baby, and if you have a baby book that you want footprints in, be sure to pull it out at this time, and we'll be happy to do that for you. We put thumbprints of the mom on the birth certificate also, and we always make sure all this is done before the baby leaves the room. There's some cardinal movements during labor. This just means what the baby goes through while it's coming out. The baby's head engages in the pelvis. While you're pushing, the baby descends. It flexes up its head, it does some internal rotation, it does an extension, which is where we see the crowning. Crowning just means we started to see the head of the baby. This point is usually when the doctor comes in the room, when the baby is crowning, and you can see a lot of the baby's head. The baby's head will come out, and then it'll turn so that it is even with its shoulders. One shoulder comes out, the other shoulder comes out, and then the baby's born. An episiotomy is a surgical incision of the perineum, that's the area between the vagina and the rectum, at time of delivery to provide a wider vaginal opening and thereby decrease pressure on the fetal head. Not everybody gets an episiotomy, but sometimes it is necessary to give the baby room to come out. Well, what if you can't push the baby out? Well, we can do an operative delivery, an assisted delivery with a vacuum extractor or forceps. Your doctor will use the method that they prefer and that usually they're best at, and for whatever the situation calls. These are two different methods to extract the fetal head from the mother's pelvis. It's useful when the mother is exhausted, if she just pushed all she can and she can't get the baby out that last little bit. It's used to avoid a C-section sometimes, or when it's not desirable for a mother to push, say maybe if the mother has some heart problems. Stage 4 is the 1-hour recovery period after delivery. We're doing your blood pressure, we're checking that fundus, checking your bleeding. If you've had stitches because of a tear or an episiotomy, we're going to put an ice pack on your perineum. And you can bond with the baby and breastfeed during this time. And this is the last time you will spend with us back in labor and delivery. After this hour is over, you will go out to your room on postpartum. So after the recovery period, you'll be moved to a regular room on the postpartum unit. It's also called the OB unit. All our rooms out there are private. They will monitor you hourly for the first 4 hours, then every 4 hours, then every 8 hours until discharge. You can eat a regular diet if you've had a vaginal delivery. They'll take care of your pain issues. If you're hurting, always make sure you discuss it with your nurse. Your doctor will have pain medication ordered for you. They'll teach you how to care for yourself for an episiotomy or any stitches, and they'll teach you how to take care of the baby too. If you have an uncomplicated vaginal delivery, you stay usually for 48 hours.